am Taylor Arnold.
And my name's Katie Kellum.
And today we will be discussing the long-term effects of child abuse. We have provided you a PowerPoint that we help you utilize throughout our presentation. First off, we are going to show a quick video clip that delves into the lives of several people who suffered from abuse as a child and the long-term effects that this abuse has had on them throughout their lives.
Well, one thing that a lot of people don't realize is that when our children are abused, whether it's sexually, physically, emotionally, those scars stay with children, in essence, sometimes for life. And then it manifests itself in underperforming children in school, or they tend to act out and get involved in law enforcement and other problems, and then they lose hope in their life.
You know, think back now, and again, she destroyed me, period, emotionally. She took the me out of me.
I think it's a struggle for children, and I think it goes on through most of their lives, for many of them, especially if they don't get treatment.
Many children including hospital drug abuse, alcohol abuse, stealing, prostitution, things that they can deal with that. And so it's a really threatening consequences from being a victim of sexual assault.
I ended up rebelling. I would fight everybody. I was always angry. I was a very, very angry person. And that led me to go to juvenile.
One of the things I do struggle with all the time is weight. There was a time about 15 or so years ago that I actually lost a lot of weight and got down to close to what the weight charts say it should be. And it was terrifying because, once the weight was off, people started being more flirtatious towards them. I started seeing myself as more of a sexual being. And immediately the weight came back on. So, there are things that you constantly deal with.
Not only to the victim, but the family is so great. It's not just the victim who suffers, while they do suffer the greatest amount. The other siblings, parents, who now have to go down a spiral of, did I do enough? Why wasn't I there?
When Anthony realized that this had such an effect on his life, it affected me in a way that I did a terrible job as a mother.
According to a peer-reviewed journal entitled The Consequences of Child Abuse, the long-term effects of abuse in childhood are visible during adolescence and into adulthood. Some studies have shown that about 80% of young people at the age of 21 who have a history of abuse or neglect in childhood meet the criteria of at least one psychiatric disorder. The seriousness of child abuse may be seen in the fact that each year, approximately 2,000 children die from abuse or neglect in the United States. The graph provided on the PowerPoint shows the steady incline of childhood fatalities due to child maltreatment within the United States. Children are suffering from a hidden epidemic of child abuse and neglect. Every year, more than 3 million reports of child abuse are made in the United States, involving more than 6 million children. The United States has one of the worst records among industrialized nations, losing on average between 4 and 7 children every day due to child abuse and neglect. This next graph shows that the most prevalent form of abuse is neglect, which we will discuss in our presentation. Throughout our presentation, we will discuss the 4 basic types of abuse and the long-term effects that each type of abuse can have on a child. The 4 basic types of abuse include physical abuse, neglect, sexual abuse, and emotional abuse. We will begin by discussing physical abuse. The American Humane Association defines child physical abuse as non-accidental trauma or physical injury caused by punching, beating, kicking, biting, burning, or otherwise harming a child. Common immediate indicators of physical abuse often include bruises, lacerations, swollen areas, and marks on the child's face, head, back, chest, genital area, and the list continues. Wounds like human bite marks, cigarette burns, broken bones, or missing hair are also common indicators of abuse. Physical abuse is often looked at as the most dangerous type of abuse because it is severely life-threatening. However, it is also the abuse in which protective services work the most quickly to stop because the physical indicators are generally more noticeable than with the other types of abuse. We will now discuss the long-term effects of physical abuse. For physical effects, serious head injuries can cause irregular formation of a child's brain. This can cause a variety of issues in the child's overall cognitive development. The stress that accompanies long-term abuse can also cause a child to develop physical ailments, such as hyperactivity and sleep difficulties, that can follow them later into adulthood. Long-term behavioral effects. There has been a lot of research on the correlation between physical abuse towards children and their delinquent behavior later in life. This research shows that children who are subject to physical abuse in relation to children who are not show a much greater tendency towards aggressive and risky behavior into adolescence as well as adulthood. Along with delinquent behavior, they often suffer from antisocial behavior, mental health problems, and a reduced tendency to internalize moral standards. Children who are physically abused are also linked with being violent in future intimate relationships and engage in earlier sexual activity. For the long-term cognitive, emotional, and psychopathological effects, physical abuse can cause a variety of cognitive deficits, including motor, cognitive, and linguistic development delays, as well as a lack of success in school. Many children also suffer from psychopathological effects due to the high stress levels, such as depression, anxiety, as well as PTSD. Physical abuse is so detrimental to a child because more often than not, it affects the physiology of the brain, which is developing at an increased rate during childhood. Next, we will discuss neglect. The American Humane Association defines neglect as a type of maltreatment that refers to the failure by the caregiver to provide needed, age-appropriate care to a child, although they are financially able to do so. There are 4 primary types of neglect. The first is physical neglect, which generally involves the parent or caregiver not providing the child with basic necessities such as food, clothing, and shelter. The second is educational neglect. This includes the failure of a parent or a caregiver to enroll a child of mandatory school age in school or provide them with appropriate homeschooling. The third type is emotional or psychological neglect. This includes actions such as engaging in chronic spousal abuse in the child's presence, allowing the child to abuse drugs or alcohol, constantly belittling the child, or withholding affection. The fourth type is medical neglect. This is the failure to provide appropriate health care for a child, although they are financially able to do so. Now, the long-term effects of neglect on health and physical development. The brain of a child who has been neglected may develop in such a way that it is adaptive for the child's negative environment, but is maladaptive for functional or positive environments. A study conducted by the Child Trauma Academy showed that children who experienced neglect had the highest proportion of later diagnosis of mental retardation. It is believed that the reason for this is the lack of stimulation for proper brain development. In order to learn, a child's brain needs to be in an attentive, calm state, which means that the child needs to feel calm and loved, but their brain also needs to be stimulated, which rarely occurs in those who are neglected. If a child is unable to learn new information, this may cause some areas of the brain to remain inactive, possibly resulting in stunted brain development. Infants who suffer from neglect often experience a medical condition called failure to thrive. This is defined as children whose growth deviates significantly from the norms for their age and gender. This medical condition can include poor muscle tone, minimal facial expressions, decreased vocalizations, and overall general unresponsiveness. The effects on intellectual and cognitive development. Malnutrition early on in a child's life has been shown to stunt brain growth and slow the passage of electrical signals in the brain, causing the child to have a cognitive, social, as well as motor deficits. Studies have shown that although both abused and neglected children exhibited language delays or disorders, they were more severe for neglected children. In order for babies to learn language, they need to experience interaction and hear sounds, which is often absent in situations of neglect. For the effects on emotional, psychosocial, and behavioral development, children who have experienced neglect have been found to demonstrate higher frequencies of insecure, anxious, and avoidant attachments with their primary caregivers. Later in life, this may cause a child to not try to solicit warmth or help from others. Some personality characteristics that are seen among people who experience childhood neglect include being highly dependent, lethargic, anxious, and having overall low self-esteem. Studies have shown that neglected children may be at risk for repeating the neglectful behavior with their own children because they do not necessarily perceive their upbringing to be abnormal or dysfunctional, and they may continue to model the behavior of the parents. Now, Katie will go on to discuss sexual abuse and emotional abuse and the effects that it has long-term on a child.
So before discussing the effects of sexual abuse, we must first know what it is. As defined by the World Health Organization, sexual abuse of a child is the involvement of a child in sexual activity that he or she does not fully comprehend, is unable to give informed consent to, or that violates the laws or social taboos of society. They also describe this form of abuse as the most cruel and tragic occurrence, as well as a serious infringement of a child's rights to health and protection that we, as adults, should be giving our children. Examples of child sexual abuse include inappropriate body contact, exposing one's genitals to children, pressuring them for sex, or using a child for pornography. Oftentimes, sexual abusers are family friends, neighbors, babysitters, but 1/3 of abusers are related to the child. The World Health Organization goes on to describe sexual abuse as a silent health emergency. It's surrounded by a culture of silence and stigma, so sexual abuse of a child often goes unnoticed. Yet even when noticed, it was underreported and poorly managed. Symptoms of sexual abuse in a child include sexual behavior or knowledge that's inappropriate for their age, evidence of genital penetration, evidence of defilement, inappropriate touching and fondling shown in the child. Sometimes sexual abuse is discovered through pregnancy or sexually transmitted diseases, or statements that he or she was sexually abused. Yet, rarely do very young children have vocabulary to speak about such incidents. Behavioral effects of sexual abuse include withdrawal, sexualized behavior, acting out, violence, or substance abuse. Behavioral effects are not limited to the ones listed on your PowerPoint. At the root of many of these behavioral problems are the emotional problems left behind by sexual abuse. Specific disorders seen in these children are post-traumatic stress disorder, attention deficit disorder, depression, anxiety, or bipolar disorder. Anxiety can even lead to self-destructive behavior like alcoholism, drug abuse, and perhaps even panic attacks. Moving further into the child's future, the odds do not seem to be in the sexual abuse victim's favor. They're more likely to be victims of rape. They're more likely to be involved in abusive or violent relationships as adolescents and adults. Now moving from sexual abuse to emotional abuse. Emotional and psychological abuse involves both isolated incidents as well as a pattern of failure on the part of the parent or caregiver to provide a developmentally appropriate and supportive environment. It's stated in the novel Recognizing Child Abuse, A Guide for the Concerned, that emotional abuse is an assault on the child's psyche, just as physical abuse is an assault on the child's body. It also states that emotional abused children suffer at least as much, if not more, than those who suffer from physical abuse. Abuse of this type includes the restriction of movement, patterns of belittling, blaming, threatening, frightening, discriminating against, or ridiculing a child. Yet this is not an exhaustive list. There are many ways to display non-physical forms of rejection or hostile treatment. Emotional abuse is almost always present when other types of maltreatment are identified. Symptoms of emotional abuse in a child include them being excessively withdrawn, fearful, or anxious about doing something wrong. They may show extremes in their behavior. For example, they may be extremely compliant or extremely demanding, or maybe they're extremely passive or extremely aggressive. These children also don't seem to be attached to their parent or caregiver. Emotional abuse leaves behind hidden scars that can manifest in several behavioral ways. The child may grow up to be insecure, have poor self-esteem, display destructive behavior, make angry acts, such as fire setting and animal cruelty. They may display withdrawal, poor development of basic skills, alcohol or drug abuse, difficulty forming relationships, and unstable job histories, even so far as to commit suicide. Emotional abuse also causes depression. Emotionally abused children are 3 to 4 times more likely to develop major depression in their lifetime. So how you can stop abuse. Amongst the negatives Taylor and I discussed today, there is a positive. You can make a difference. At this point in our presentation, we would like for you to look at the handout provided to you. Ending child abuse starts with you, and we wish to leave you 7 take-home points on how you can make a difference and help end child abuse. Number 1, educate yourself. Learn the facts and understand the risks. 2, minimize opportunity. If you eliminate or reduce one-on-one adult and child situations, you will dramatically lower the risk of sexual abuse for a child. Number 3, talk about it. Children often keep abuse a secret, but barriers can be broken down by talking openly about it. Know how children communicate and talk openly with a child. Number 4, stay alert. Don't expect obvious signs when a child is being sexually abused. Signs are often there, but you have to spot them. Know and learn these signs. Number 5, make a plan. Learn where to go, who to call, and how to react, but be careful not to overreact. Number 6, act on suspicion. Trust your gut feeling, because a child's well-being may depend on it. Number 7, get involved. Volunteer and financially support your organizations that fight tragedy of abuse. Use your vote and your vote. Use your voice in your vote to make your community a safer place for children. So to wrap things up, in conclusion, we hope you walk away from our presentation today more educated about not only the different types of child abuse, but also the harmful long-term effects that it has on children. We also hope you walk away from our presentation with the mindset that child abuse can be stopped, and perhaps even take home the 7 points we gave you today. As our take-home message, we would like to leave you with wise words from Dave Pelzer, author of A Child Called It. Pelzer stated, "Childhood should be carefree, playing in the sun, not living a nightmare in the darkness of the soul." Our aim today was to inform you of the harmful long-term effects that child abuse has on children, both nationally and within our own communities, as the end of abuse starts when we all become educated. Taylor and I hope that today we have maybe shed some light on the subject of abuse, and by shedding light, we have therefore took a step towards allowing all children to live in the light of the sun. We thank you for your time and hope that you'll also look at our references noted on the next 3 slides of our PowerPoint. Thank you for your time.